If I told you there was a treatment that's completely non-invasive, natural, side effect free, it has been studied for decades, and has shown improvements in egg quality, sperm motility, blood flow, inflammation, pregnancy rates, and more, would you believe me? What's even more interesting is that some of the research suggests women may benefit more from this type of therapy as they get older. It's called photobiomodulation. It's also known as cold laser or low-level laser therapy, LLLT. I'm Dr. Mimi, and today I want to talk about light therapy. And while it's been used for years in physical medicine to help tissues heal, for example, in our clinic, we've used it for over a decade to help heal disc herniations, chronic low back pain, injuries like rotator cuff tears, meniscus, and so much more. Researchers have been asking whether the same treatment can help reproductive tissues function better too. And the results, I think, are pretty exciting. I don't think there's a single other modality that has as many benefits as this one here. I just think it's one of the most fascinating tools. So today I'm going to walk you through what photobiomodulation is, how it works, the widespread benefits that can support fertility, and we'll look at some of the research. If you're wondering if this could be a good option to support your fertility, you will have a good idea by the end of this video. So let's get into it. First, what is biomodulation? There's a lot of terms for it. This is light therapy. It uses low intensity red light, usually around 630 to 660 nanometers, and near infrared light, or NIR, roughly 800 to 900 nanometers, which are the wavelengths of light, and they penetrate skin and interact with your cells. It's non-invasive and it has next to no known side effects when used appropriately. At the most, you'll feel some warmth when using it. And this is how it works and why it matters and is so exciting for fertility. First, if you're thinking about your red light face mask or your portable red light device you have at home and wondering if it's the same, they fall under the umbrella of photobiomodulation, but these portable consumer devices aren't the same as the types of photobiomodulation used in the studies I'm going to reference. And I do think portable consumer devices can be beneficial, but I will explain this in the last video in the series, so go there to learn more. This is a 4-part series, by the way. And I do often find people aren't using the right settings and unfortunately not getting the benefit. So make sure you watch that video if you have a red light device. But the reason photobiomodulation is so exciting is it literally improves cellular function. How? Here's where I'm going to get a little sciencey, and I think it's just so cool how it has multiple mechanisms. There's probably more than this, but I think these are the ones that are most relevant for fertility. Number 1 involves mitochondria and cytochrome C oxidase. So mitochondria are our energy producers, right? The powerhouses of the cell. They make ATP, which is energy. I talk about this all the time. Women have the highest concentration of mitochondria of any cell in oocytes or eggs. Creating healthy eggs requires a lot of energy. So mitochondrial health is especially important for women. And this therapy literally improves mitochondrial function, which, by the way, mitochondrial dysfunction is a key driver of age-related decline in egg quality. Obviously, we can't stop aging, but we can improve mitochondrial function in the ovaries, which improves egg quality. This is a reason research suggests the older women are, the more they may benefit from this treatment. So how it works is this enzyme called cytochrome C oxidase is a key enzyme in the mitochondrial electron transport chain. It's what absorbs the photons from red and near infrared light. And when those photons hit the cytochrome C oxidase, they displace inhibitory nitric oxide, boost electron transport, and increase ATP production as a result. Remember from high school, electrons move through the electron transport chain, and that process helps generate ATP. More ATP means more cellular energy for everything from DNA repair to hormone synthesis to egg maturation. The ovaries are highly energy dependent, and mitochondria play a major role in egg quality and ovarian function, and we can use it over the pelvic region for this reason. So that's really the foundation of cold laser therapy. But there's more. There's a lot more. Photobiomodulation has also been shown to improve inflammation and oxidative stress. Why does this matter for fertility? Another thing I talk about all the time. Chronic low-grade inflammation and oxidative damage are drivers of poor egg quality, ovulatory dysfunction, endometrial receptivity issues, and even implantation failure can play a role in. Photobiomodulation has been shown to lower prostaglandin E2 and pro-inflammatory cytokines like interleukin or IL-1 beta, IL-6, 8, 12, and TNF-alpha. It shifts macrophages from the inflammatory M1 phenotype to the anti-inflammatory M2 phenotype. And under pathological conditions, it reduces reactive oxygen species, or ROS. That's what drives oxidative damage, something I also talk about a lot. It's just so amazing. This aspect is particularly important for endometrial health and implantation. You may recognize some of the cytokine names IL-6, TNF-alpha, because reproductive immunologists commonly test them, and interleukin-1 beta, and elevated levels are associated with recurrent pregnancy loss, recurrent implantation failure, and endometriosis. And if you're wondering, well, don't these inflammatory cytokines impact other health outcomes? The answer is yes. So lowering inflammatory cytokines doesn't just support fertility. Those same pathways can drive insulin resistance, joint degeneration, chronic pain, and more. Photobiomodulation appears to modulate them systemically. Also, prostaglandin E2 I mentioned, that's a major driver of period cramps. And many women report improved symptoms with their cramps using this therapy, or after using this therapy, I should say. Next, very importantly, photobiomodulation improves angiogenesis, meaning it can support the growth of new blood vessels and over time help improve blood flow. This matters for fertility because the ovaries, uterine lining, and placenta all rely on healthy blood vessel growth. In the ovary, angiogenesis supports follicle development and the corpus luteum after ovulation. In the uterus, it helps the lining remodel each cycle and become ready for implantation. And in pregnancy, proper angiogenesis is essential for placental blood supply. Defects in this process are linked to miscarriage and other pregnancy complications. So, by supporting VEGF-related pathways, photobiomodulation upregulates VEGF, or vascular endothelial growth factor, and this can help create a more oxygenated, nutrient-rich environment for reproductive tissue. This means supporting a more receptive environment for implantation. Speaking of tissues, photobiomodulation also affects tissue repair and adhesion reduction. Photobiomodulation, I want to say PBM because it's so much shorter than photobiomodulation. So if I say PBM, that's what I'm referring to. But this improves functionality in scar and surrounding tissues, creating better movement between layers of skin, fascia, and abdominal muscles. For anyone with prior surgeries, endometriosis, or pelvic adhesions, which I often find, this is clinically relevant. Pelvic adhesions are a major cause of mechanical infertility and are largely unaddressed, unassessed, and unaddressed. And can you have pelvic adhesions without a history of surgery or endo? Yes, and I see it all the time. A couple more things I want to shed light on. Pun intended, I guess. PBM also modulates nitric oxide, which I mentioned earlier in the video. It can help release nitric oxide from cytochrome C oxidase, which supports vasodilation and blood flow. But also in inflamed tissue, it may help calm excessive nitric oxide and NF-kappa beta signaling, which I'm not going to get into in this video, but basically NF-kappa beta attaches to docking sites on DNA to turn on inflammation. And photobiomodulation can help calm this. It's not just about getting more nitric oxide always, it's about restoring healthy balance. And one more thing I want to talk about, importantly, very importantly, is the gut connection. This one is so fascinating to me. Photobiomodulation can also help the gut, and this matters for fertility because the gut impacts everything else. Red and near-infrared light can shift the gut microbiome toward more beneficial anti-inflammatory bacteria. Again, it can lower inflammatory cytokines, and it can help protect the intestinal barrier. It's the barrier that keeps bacterial toxins like lipopolysaccharides from leaking into circulation and driving the systemic inflammation and insulin resistance. That can all interfere with ovulation, egg quality, and implantation, which is a whole other big topic for maybe another day. But my point is, a healthier gut means a more fertility-friendly body. Conveniently, the gut is right above the pelvic region, so we can easily treat both. All of these mechanisms converge on one idea. Fertility isn't just about hormones. It's about cellular energy and the environment that eggs, sperm, and an embryo develop in. Not only can photobiomodulation help improve mitochondrial function and egg quality, but the environment an embryo will implant and develop in, It can help soften scar tissue, and of course, combine that with the improved blood flow support, and now we're really cooking. There are thousands of studies on photobiomodulation, but the fertility research is still emerging. So in the next videos, that's what we're going to get into, specifically for women and men. Does photobiomodulation actually improve egg quality, implantation, IVF outcomes, and pregnancy rates? And while there's still a lot more research to be done, I think the results are pretty interesting and remarkable, in my opinion. So I'll see you there. Don't forget to like, subscribe, and share if this video was helpful.